The information shared on CNS Unfiltered is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your healthcare provider before making any health or lifestyle changes. The views shared are those of guests and do not necessarily reflect those of Innate Clinical Nutrition or its affiliates. This episode includes affiliate links, which help support the show. Hello and welcome. I'm Jena Salisbury, and this is CNS Unfiltered, a show where clinical nutrition specialists uncover what traditional medicine overlooks. I am so excited for today's episode because we're discussing something that really hits home for so many people. Today, friends, we're talking skincare. Maybe this is a situation that's familiar to you. You've been struggling with acne for so much of your life. You had it in your teens. You were told it's just a normal part of growing and you would eventually grow out of it. And you've reached adulthood and still see it in your face every time you look in the mirror. You've been to doctors, you've been to dermatologists, estheticians, all of the peoples. You've tried antibiotics, you've tried the medication, you've switched your skincare routine more times than you can count, and spent more money than you're proud of on products that just sit on your shelf because they're not working. We've been told it's hormones, right? We've been told it's stress, caffeine, dehydration, too many products, not enough products, and it's exhausting. I get it. Maybe you feel like you can't show up authentically in your personal life because of the insecurities about your acne. Maybe it's all you think about. And maybe this whole time, while you're being exhausted by every effort or possibility, the solution has been hiding in plain sight. Maybe you're running to the dermatologist, but eating a diet loaded with added sugar, dairy, or other skin triggering foods that are sabotaging your efforts to banish that acne. Or maybe you're making changes in your diet to eliminate those triggers, and you're seeing a real difference in your skin health. Either way, today's episode is for you. A lot of us don't think about the ways that our gut health and our skin are connected, but they absolutely are. We get to explore that today. Today, I'm going to talk with Bri, a CNS professional and the owner of Your Skin Answers, a skincare clinic that is focused on using nutrition science and gut health to resolve complex skincare problems from the inside out. We'll talk about the gut and skin connection, why and how certain foods are triggering to our skin, what foods and supplements can be incorporated to support both. We'll talk to Bri about how her passion for nutrition led her to the career as a CNS. And then we'll do a deep dive with one of Bri's former clients, where we'll discuss what she did to help this client finally get rid of her acne and heal her gut along the way. Today's episode is powerful and inspiring. And if any of this sounds like you, I hope that you can find some answers. Hello, everybody. Welcome to CNS Unfiltered. Super excited to have you here today. We have Miss Bri with us. Bri is the owner of Your Skin Answers, and she's going to be going over a client with us on how she was able to turn the corner with them in their skin issues. So, Bri, welcome. So happy that you're with us today and that you're willing to come and share your experiences with us. I love to turn the spotlight on you. What led you to this field? What led you to where you are now? And what are your passions within it?
Oh, those are a lot of questions. But first, I'll just say I'm really glad to be here too, and excited to talk through a case with you. But to answer your question, so how did I become a CNS? That was one of the
Yes.
questions, correct?
Yep.
Well, we were talking a little bit off screen about your path to CNS, and just like everybody, I have my own journey to this profession. I will say I'm going to try to keep this as succinct as possible. So the whole
Sure.
episode's not just on this. So after high school, I really had no idea what I wanted to do. Um, I ended up doing 2 years in massage school, or excuse me, it was a year program in massage school. And then my mom really pushed me to, she really wanted me and my sister to have an education. So I was like, okay, I'll just pick something. And the only thing at that point that I liked doing was working out. So then I was like, oh, there's an exercise science program. I'm going to do that. This is going to be great. Loved the program. While I was finishing the program, I I got enrolled in a health coaching program, the Institute for Integrative Nutrition, IIN. So I went that route, was starting to finish that up. And then towards the end of the program, I'm pretty sure it was Mark Hyman, like one of his talks, but he came on and I got exposed to functional medicine. And I was just blown away. I was like, this is exactly what I believe medicine should be. And I just, I was sitting at my desk and I just put my hands down and I was like, I don't know how this is going to happen, but like I'm going to end up being in functional medicine and helping people someday. Fast forward, I found an online nutrition program in human nutrition and functional medicine through the University of Western States and completed their 2 year master's program. And, then through the internship and everything, I was able to become a CNS. And this is kind of where my path has brought me so far.
Oh, beautiful. I got goosebumps with it because it's true. Like once you if it aligns with you, right? Like once you hear a functional medicine, you're like, I'm never leaving. Like once I learned like that was what I was looking for, it's like, oh, I'm in. I'm 10 toes forward, jumping. Let's go.
Yep, exactly. And so, like my own personal health journey, I struggled with acne through high school, been to dermatologist, tried the antibiotics. And there was something inside of me that just kept on saying, but like, why am I getting this? Like, I'm clean, I'm washing my face, like I practice good hygiene. Like I eat relatively well, what I thought was good at that time, right? So I was just like, I wanted to get to the bottom of what was going on, what was actually contributing to this. And I'll tell you what, Jenna, I remember reading about the like antioxidant profile of blueberries and it just blew me away. Like again, like I had no idea like food, like there was so much happening inside the food that we decided to put into our bodies. So that really put me down on this path too of just like there's a root cause and if we give the body what it needs, then the body will heal itself. And that's really what brought me to functional medicine and integrative health.
Beautiful. And I can only assume that's what tracked your business into your skin answers.
Yeah, that's a whole story in itself. But yes, through multiple like reimaginations of my business, it is now Your Skin Answers. And I primarily help folks with chronic skin conditions like acne, eczema, psoriasis, who also have like some sort of chronic GI concern, whether that's constipation, bloating, gas, diarrhea, things along those lines.
Awesome. Awesome. What did your client, let's just jump in.
Let's do it.
So, what did your client come to you for? What did she reach out to you for?
Yeah, well, two of my favorite things, right? Acne and gut
Yeah.
issues, right? So I'm gonna change her
Mm-hmm.
name, of course, but
Yes.
I did
Yes.
talk with her and told her that I'd be sort of telling her story, and she gave me consent, of course, to kind of go ahead and go through
Perfect.
this. But Jennifer came to me in September 2024. She is a 30-year-old African American female whose main complaint was persistent acne. But she also complained of oily skin, chronic constipation, and bloating from certain foods. She reported that acne began in the 8th grade or early high school. She just said it was like sometime around there. And she also had a history of irregular bowel movements and constipation since childhood. And I'm just giving a little bit of background. So
Yep.
she experienced bloating with certain foods like kombucha, beans, and pizza. I did ask her if she bloated after foods like onion and garlic, because we know that these foods, especially garlic and onion, they're high in FODMAPs in well, fructooligosaccharides are one of the FODMAPs, but those can react with certain bacteria in the gut and cause or contribute rather towards GI symptoms like bloating, gas, even constipation and diarrhea. So usually if folks say that they're bloating after certain foods, that's kind of a telltale sign that like, hey, maybe we should look more deep into this, or maybe a referral is needed for a more, conventional workup or something. So she tried several interventions at this point to help her acne, including birth control pills, various skincare routines and products. And then what she was currently using was Neutrogena oil day and night, and then an Elta MD recovery serum. Now, she had looked me up prior. She said she Googled like dermatologist nutritionist. So, 3 cheers for Google and popping my business up. But
Cool.
I have a freebie called an acne supplement guide, and it walks folks through evidence-based supplements to help their acne. So she found that and actually started taking some of the recommended products from that guide. So she was taking an acne-specific probiotic called Serene Skin, omega-3 fatty acids, and another product called Acnutrol, which was an acne-based supplement. And then finally, an adaptogenic herb blend called Adrene Vive. And she was taking that for about a month before she reached out. So she was sort of already on this like healing alternative program, if you will, through the supplements.
Awesome.
Unremarkable family history, no known food allergies, but she had self-reported environmental allergies. And I'm based in Illinois, so we do get a pretty severe like spring and fall flare in people's environmental allergies. So this was fall, so this was September 2024, so it made sense. So her lifestyle definitely could use support. So for sleep, she was only sleeping around 6 hours per night. And on top of that, she was drinking 4 cups of coffee per day, which included sugar-filled drinks as well. So not just black coffee, but she was also adding sugar and creamer to that. A dietary recall consisted of a veggie scramble with turkey sausage for breakfast, Starbucks or meal prep soup or Uncrustable for lunch or a snack. Then she said she would just have some sort of bread or noodle or another Uncrustable for another like lunch or snack. And then dinner mostly contained protein and a veggie. So she listed like lamb shank, green beans, or fast food. Okay, so lots we can do with the diet there too to help. Her medical symptom questionnaire total was 52. And just a little background on the MSQ, it's a questionnaire that identifies symptoms that help to identify the underlying causes of illness. And not only that, but it also helps practitioner and patient track their progress over time. So she started at 52, and once we go through the intervention, we'll see, what the score was there. So it's a good visual for patients to see, oh, I started at 52, and now like I did all this work, and where am I at now? So it kind of helps them adhere to the treatment plan and know that what we are working on together and what she's actually applying is actually helping and producing some results.
Did she go through the traditional medicine route? Did she see the dermatologist? Was she put on any antibiotics or anything? Like, how did they treat her or fail her or help her
Yeah,
before coming to you?
good question. So I was actually her first stop. So she said she really wanted to exhaust like natural and integrative approaches first before
Cool.
she went to a dermatologist, because in her words, they're just going to put me on medication. And she kind of already had an idea that maybe foods were contributing to her symptoms. So yeah, she was just like, I really want to see, like her words were, I want to find out what's contributing to my acne and find a long-term plan that's going to help me be clear without the use of medications.
Beautiful. So when she came to you through that questionnaire, were you able to kind of, and the questions, right? It was very specific questions of what foods.
Hmm.
As a CNS, we're kind of trying to find pathways. Am I looking for SIBO? Am I looking for digestion? Am I looking like kind of narrowing it down so we can understand what the next moves are that are appropriate? Did you use that questionnaire to kind of guide your protocol? Or do you have set protocols that, are just kind of overviewed and there's just specific things that you find work for your clients? Or do you jump into more testing?
Yeah, that's a good question. So each client's a little bit different. Each patient's a little bit different. I think in our mind, we always think that it's going to be one way. And then, like, as we're working with people, it always ends up being something different. What I do for everybody is I do really start with a food first approach. So, like, without even asking for more testing, I already said, look, we need to, like, improve your diet, right? And like, this is what it looks like, right? And then we'd go through that education, which of course we're going to talk about that a little bit later. But I start with diet because that's something that she has immediate control over, right? It's something that she can implement right away into her day. The next time she chooses to eat something, she can already start like, fueling her body, like getting antioxidants and getting more fiber in. And we talk about that. But yes, I do like blood testing. I like to still see kind of like the standard test, if you will. So like a CBC, complete blood count, a CMP, the comprehensive metabolic panel. I like to see some inflammation markers, especially like high sensitivity C-reactive protein. I'll see like an ESR. What else? I like to see what vitamin D is doing, insulin. I like to see a fasting insulin as well. For her, I decided seeing like a full thyroid panel would be appropriate for her. And then later on in her care, we ended up doing an omega-3 index and a vitamin A
Awesome.
retinol to see what those were doing. We also looked at some vitamin markers. So we looked at like zinc and copper and also vitamin B12 as well.
Can you jump in on why the omega in the A panel was so important to know when referring to the gut and skin?
Yeah, great question. I will say that these are relatively new markers that I have been have been asking for or assessing with patients, but the omega-3 index gives us a good breakdown of omega-3 fatty acids and omega-6 fatty acids within blood cells. What we see in a standard American diet is that most of us are eating way more omega-6 fatty acids than we are omega-3. So we really want that ratio of omega-6 to omega-3 to be like 4-to-1. But what we're really seeing, what's standard, is more like 20-to-1. So it's a good assessment, not only from the dietary recall, and just asking her, how often do you eat fish or walnuts or chia seeds or like other fatty fish like sardines, right? Like I've only had like one person in my whole career tell me that they enjoy sardines, right? So like, it's not common for people to eat these foods. At least in the Midwest. I don't know about where you are, but
I'm in Michigan. I'm right there with you.
okay. So it's good to see because when we eat more omega-6 compared to omega-3, that can increase inflammation. It pushes our body down a more inflammatory cycle, if you will, compared to what gets pushed down if we were consuming more omega-3s. So that's good to see. It's good to assess that. And her values were low, right? Her omega-3 values were low. Her omega-6 were a little bit higher. So we discussed that. We discussed what the differences were between omega-6 and omega-3. And then for vitamin A, that's important to assess because vitamin A,
Vitamin vitamin A to me like is needed for the healing of the mucosa to seal it up from getting to the skin. The skin is the mucosa. Thank you for explaining, those tests. I think it's something that I see in practice too, is because, as you mentioned, right, a CNS is basic test. They're not just the basic test. We want to see the CMP, the CBC, of course, but we're going to add on to that. And I don't think a lot of our clients or patients know that we have an array of tests like that we can take, but or that the physician can run. And the catch is,
Mhm.
right, but I don't know, at least what I see, if you can vouch for where you are too, is they'll run it, but through insurance, it's going to be a hard kickback. So where if you run it through a CNS and we're doing more of a cash pay, keeps the costs down, and we have a lot more access to a variety of testing that people may not even know are out there.
Yep. Yep, exactly. Yeah, and if I can just throw a number out there, I believe that the test that we ran for this patient was under $200 for all of that.
Awesome.
Hmm.
Yep. Perfect. So, how far did you get with the supplements and the foods? How long did it take for her to start seeing changes? And what were the first things that she was able to see?
Yeah, we saw changes relatively quick. So we had her first appointment, and then I wanted to see her in about a month to assess the changes. So, from a food standpoint, what we actually did was I recommended an elimination diet. So I recommended that for 3 to 4 weeks. Her choice, educated her on why we want to do this. Specifically, we wanted to remove dairy, gluten, red meats, eggs, and refined sugar. So any added sugars. And part of that was, I asked her, like, do you think that there are any foods that break you out? And, it's like people have hunches, right? And so, like, I play on that, right? Because she's an active participant in her care. So she said, I think eggs break me out. And I said, okay, let's eliminate them for 3 to 4 weeks and see, what happens. She comes back in 4 weeks and we saw a lot of things change. So Jennifer reported improvements in multiple areas. Weight decreased from 143 to 133 on the elimination diet. I did tell her that that might happen, but of course, I told her it wasn't the main goal of the elimination diet. And just to reiterate, the main goal was to remove those potentially triggering foods for her that might be causing a little bit of low grade inflammation. And eliminate them to see if we saw some improvement in her symptoms, whether that was her GI symptoms or her skin symptoms. Her digestive patterns improved, so she was only having like 1 to 2 bowel movements a week, and those increased to 3 to 4 per week. Gas reduced, bloating reduced. Overall, her redness that she was experiencing with the acne lesions reduced, and then total lesion count reduced as well. And that just means like how many active acne spots there were on her skin reduced at the 1 month mark from baseline. So this was just a month of intervention. At this point, if you remember, she would have been on the supplements for 2 months because she was on them for a
Perfect.
month before she came to me. Other changes though, like increased energy. She said she's never had this much energy in her life. She had reduced brain fog, and her MSQ decreased from 51, I believe it was, to 19. So improvements with the GI symptoms, mental, emotional, and then skin specifically. And those,
Awesome.
yeah, those were some of her biggest improvements that we saw.
So I can only imagine our audience right now saying, yeah, totally. Like a half of them that could say totally can see an elimination diet clearing up the skin, where we have the other half who might be, visiting the dermatologist and getting on low grade antibiotics or anything to clean it up, saying, my dermatologist never told me about food being able to clear the skin, especially in a month. If you can kind of go down that rabbit hole of how the food changes, maybe the pathways, or you touched on the inflammation, how that's connected. And then the other piece is elimination diet is a pretty strict diet. Was she able to introduce those foods in? How long does she have to be on that diet? And is that sustainable?
Yeah. So, how the elimination diet is related to potentially affecting skin health is one, we touched on it, but the inflammation, right? So, if food is introduced into the body and our body reacts to it, then there's going to be some form of like downstream effects that occurs, whether that's inflammation, our immune system is activating in some way, right? Which we don't want that to happen. It really shouldn't be happening. The foods we eat, we should be able to extract the nutrients from it and then excrete the rest of it. But what happens sometimes is over time, there could be a breakdown of the gut barrier, and this is called dysbiosis. So how I explain it to my patients is like we want our gut lining to be tight like this, right? We don't want any holes in it. We want it tight in the sense that when food particles are passing through, nothing's sort of getting through these cracks and able to react with self. Over time, if we're consuming foods, or it can be from environmental toxins or, even psychological stress, what can happen is we see a breakdown, or a Western diet, right? Inflammation, cigarette smoke, alcohol, right? These things can all sort of interact with this interface here. But if that does happen, if there is dysbiosis, then what we see are we start to see these little like cracks in the gut's surface. And food particles pass through. So let's say dairy, right? It's a relatively large molecule, but it can kind of pass through, and then our immune system reacts to it, right? It's kind of like, what the heck is this? This isn't supposed to be in here. So that's one way at like how the gut and what we consume can impact the skin.
So once these proteins get put into the bloodstream, then the body has no way of detoxing them, right? We're out of the gut with all of our ways of detoxing. So the body has to elect its secondary immune response, right? So this is going to be our IgG immune response. And it's going to wake up and say, hey, dude, you're not supposed to be here. You're supposed to be in the gut, turning into something we can use, or detoxing out. So then the body goes, and I call this immune system our police, and they're going to arrest it because they can't just let it roam the body doing whatever they want. And they're going to go store it. I'm going to go put it in jail. Normally this is a tissue, right? So a lot of times, usually I find the joints or the brain first. But then once that toxic load gets too high, the skin is our biggest detoxer. It's got to come out. So it is part of that detoxing process. So really the body's trying to protect you and get these toxins out. But from my understanding with what you do, you seal it up from the beginning. So that leaky situation from the dysbiosis gets all sealed up with the supplements and the diet, right, from bringing down that toxic load. And then the body gets to kind of make that shift.
Yes. Yes, exactly. Beautifully said. I love all the analogies, right? We kind of have like, we can use our hands, we can, call the immune system the police, and people seem to understand that a little bit better.
Yeah. After 15 years in here, I feel like I have an analogy for everything. And I'm a Virgo, right? When I first started, it was biochemistry. This is chemistry. This is black and white. And then I'm like, yeah, this is not how you work with patients. Yeah, exactly. It's not going to work.
Exactly. And I love the teaching aspect of it. So I'll like pull out a whiteboard and like draw, and just like, I really love like, really teaching about like, this is what's happening, and like, this is how the intervention we're discussing is going to help sort of, help all of that.
Because it's adherence too, right? Like that's something that we can get that a physician might lack too if they're not in that trust. But if we can break it down and lay it out and they have a visual and a take home. One of my coworkers from Nava, he sits with a blackboard behind him. And I'm like, man, I love being a fly in your room because it's like you're in a lecture.
Yeah. Yeah. I love that.
Yeah,
I'm
me
I'm
too.
a whiteboard gal myself.
Well, thanks for geeking out with me there for a second. I'm going to turn it back on to you. So how long does she have to stay on that diet? And when was she able to introduce foods back in?
Yeah, so I just recommended staying on the diet for 3 to 4 weeks. So really until I saw her again. And then we discussed reintroductions. She actually chose to stay on the diet a little bit longer because she said she felt so good. But I was like, that's completely up to you. Like the next step would be to reintroduce these trigger foods. Um, we start with a small amount, wait a couple of days, see if there's a response, right? For her, it seems to manifest in the skin. And then we sort of use that data to move forward, right? Like, oh, did you eat eggs? And then a few days later you broke out. That's pretty good data to be able to take with you to create a truly personalized plan for Jennifer here to be able to take with her for the rest of her life. Because then she knows, like, oh, eggs really do bother me and they contribute to my symptoms. So I should stay away from that. Not only should, but like seeing that something that you put in your body directly affects you negatively, I think that also triggers something in our patient's mind because they're just like, why would I want to eat eggs and then like break out or like get a terrible headache or whatever symptom, is kind of manifesting from this food introduction. So I kind of let her take the lead after I explained the reintroduction process. And over the next just like 6 weeks, she reintroduced the foods, but she chose to still eliminate red meat and eggs.
Awesome.
Hmm.
Yeah, it's powerful, right? Food is the most personal thing we do with ourselves every day, and it is hard to change food, especially when you
It
don't
is.
know why you're changing it or if it's going to work or how long to do it. It could be a little defeating. So that was awesome that she got to feel good really fast and got to add in all of those foods again.
Yeah. Yeah. And I will say Jennifer has been my most motivated patient that I've ever had before. Like she came with me ready to make the changes necessary to see these improvements. So, that was truly inspiring for me because then I just felt like I had to educate and she would take what I did and actually do it. So that's really nice to see in a patient too.
Definitely. Well, because it takes two, right? We can't do the work for them. We got the knowledge, we'll coach, we'll tell you where to push, but all of that work comes from the client. And when I have clients, they're just like, thank you, thank you. I was like, no, I didn't do nothing. I'm doing my passion. You did all the work. You were the one cleaning out the pantry. You were the one saying no. You were the one saying no to the birthday cake. And like that takes power and commitment, but also understanding. So you were definitely able to give her that understanding of what foods to take out and why that's important, but then how to give her the power back. And that's what we get to do with food versus pharmaceuticals is give our clients that power back. What would you say is a myth that you would like to just kind of debunk
As it relates to,
as it relates to skin health?
oh, a myth. Well, I have seen just on social media, like I see these people post that food does not have anything to do with skin health. And I really don't understand like why they're putting that out there because we see from multiple observational studies, and of course that's not like a cause and effect sort of situation, right? Like we can't say that like dairy consumption causes acne, but there's definitely an association there. And multiple studies at this point have come out and have said that really like a dairy-free and low glycemic index diet is recommended for patients with skin issues, especially acne. So that would be one I would say like food definitely has an association with what's going on the skin, and it's something that you can actively affect every single day by choosing what you're going to put into your body.
1000% agree. 1000%. Right. It might not be a causation within a 1 to 2 step, but as a CNS, we're looking at the full cascade. We're looking at from beginning to end, not just taking the body apart and looking at one piece, I guess. But how could people find you? How could they reach out? Who would best benefit from reaching out to you? What is the system that they can expect?
Yeah, so people who struggle with chronic skin conditions, and the chronic skin conditions that I love working with is acne, eczema, and psoriasis, and rosacea, and who also have gut issues, right? And I think that's the majority of the United States population at this point. But you can find me at yourskinanswers.com and also at my Instagram handle, yourskinanswers. Um, and did you also ask like the process of working with me?
Yeah, like what would happen if they show up to your website? What's next? What do you want them to do?
Yeah, so usually most patients start by setting up a free 30-minute call. And this is just to see like, hey, one, are you a good fit for me? But also vice versa, right? Like, am I a good fit for you? Because sometimes, people just don't mesh, and I might have a referral for them that they could, potentially go to somebody else. But yeah, we have to make sure it's a good fit for both of us. So we start with a 30-minute free call.
Perfect. Perfect. Anything else you'd like to say before we wrap it up today?
I will say one last thing, and I'll just say that clear skin is possible, and it's really my ethos. It's kind of like why I show up every day, but I believe that when you get clear, you can do good in the world. So, from my own personal journey, like I struggled a lot with like self-confidence and self-worth, and because the acne was so bad, like I didn't like show up fully as myself. So it's like my hope that through this work that like I'm putting good out in the world, and I'm hoping to sort of create a ripple effect where other folks can come to me, kind of get clearer skin, get more confident in themselves, and then turn around and give that back to the world and the community where they live. So that's the last thing I want to say.
Oh, thank you so much, Bri. Thank you so much for all of the work you're doing, for your passion, for just finding functional medicine and running with it.
Thank you, Jenna.
Thank you again, Bri, for sharing your passions and experiences. I know your clients are so lucky to have you, and I'm so happy you found functional medicine. Thanks to our listeners for tuning in today for this episode of CNS Unfiltered. Your gut and your diet impact your skin in profound ways. And hopefully you found Bri's experience with her client as empowering as I did. It's encouraging to know that when it seems like nothing's going to change or get better, that we actually do have at least some control, some power after all. For any listeners in Illinois wanting to get in touch with Bri and schedule that 30-minute phone call, remember to go to yourskinanswers.com to reach out. And of course, be sure to follow her on Instagram at yourskinanswers for more skincare and gut magic. And even if you're not in Illinois, if you're struggling with your skin health or your gut health or both, a CNS might just be your light at the end of the tunnel. Once again, I'm Jena Salisbury, and remember to listen to your gut.